Hello and welcome to the Accelerating Kids Access to Care Act Town Hall. This event is co-hosted by the Pediatric Brain Tumor Foundation and Leukemia and Lymphoma Society and the National Brain Tumor Society. Today you will hear from lead sponsor U.S. Senator Chuck Grassley of Iowa. You will also hear from our partners, the Brain Tumor Network, a patient advocate from the Leukemia and Lymphoma Society, and staff from Senator Grassley's office. Our program will be moderated by me, Mike Henry of the Pediatric Brain Tumor Foundation, Matt Marks of the Leukemia and Lymphoma Society, and Natalie Schmidt of the National Brain Tumor Society. We thank you all for giving us time on this Wednesday afternoon, and we are excited to educate you about this important piece of legislation. First, a programming note and some housekeeping. Senator Grassley will be joining us around 4 p.m. If we are in our Q&A session, we will pause for his remarks. This program will last approximately 90 minutes. As you see, you are muted and video is disabled for attendees. Please use the Q&A feature to ask your questions. We will try to answer as many as possible. A recording of this event will be available and sent out to registrants. First, just a little background on the Accelerating Kids Access to Care Act. The Accelerating Kids Access to Care Act streamlines the burdensome state Medicaid enrollment process that clinicians must complete before seeing out-of-state Medicaid patients. Because each state has their own often complicated requirements for enrollment, clinicians and hospital administrators are made to jump through hoops before they can see their patients. The process can lead to delays in care for children traveling across state lines for treatment. As we all know, children with cancer don't have time to wait. Even with the smallest delay in care, that delay can affect their treatment plan or chances for survival. The Accelerating Kids Access to Care Act creates a simplified system that reduces the administrative burden of providers that are already well qualified in their own state Medicaid program. This legislation does not require out-of-state patients to receive care, but simply streamlines the process once those decisions have already been made. This important legislation will save families and clinicians valuable time, and in some cases, save the lives of children in the most critical conditions. All of our organizations strongly support the Accelerating Kids Access to Care Act and believe it should be passed as soon as possible. To start our panel, we would like to invite Molly and Beth, nurse navigators from our partners at the Brain Tumor Network, to speak about their experiences shepherding families through this painful process. Molly and Beth, thank you for joining us.
Hi, everyone. We're Molly Geer and Beth Armstrong, the Pediatric Neuro-Oncology Nurse Navigators at the Brain Tumor Network. BTN is a nonprofit organization founded in 2014 with a mission to provide free, individualized navigation to help patients and their loved ones manage a primary brain tumor diagnosis, overcome treatment obstacles, and facilitate access to quality healthcare. In 2002, the Brain Tumor Network expanded our services to the pediatric brain tumor population. In the first half of 2024, we have already connected with 32 pediatric families to provide our personalized navigation. Patient navigation is defined by many organizations, including the Oncology Nursing Society, as individualized assistance offered to patients, families, and caregivers to help overcome healthcare system barriers and facilitate timely access to quality healthcare and psychosocial care from pre-diagnosis through all phases of the cancer experience.
Two primary needs that the pediatric population commonly have are helping families identify centers of excellence for a second opinion and using our proprietary clinical trial matching system to identify potential trials that meet a child's specific tumor and diagnostic characterizations. For the American Brain Tumor Association, one way to ensure that you are making an informed decision is to seek a second opinion from a doctor or multidisciplinary team of specialists. A second opinion can help confirm and provide more information about your diagnosis. It can also provide additional perspectives, resources, and especially treatment options. One of the biggest hurdles we find in providing families with the support they deserve and access to potentially life-saving medical opportunities is state-based Medicaid. The inability to be evaluated and treated in a timely manner outside of their residing state limits treatment options and opportunities for cutting-edge therapies. Most treatment protocols are time-sensitive. Research has shown that each protocol has a specific timeline that provides the best outcomes for children. Clinical trials also have extremely strict timelines that must be followed for eligibility. These timelines start at the date of surgery or the date of an MRI that raises concern for progressive disease. There is no leeway in these timelines. Even short delays, 1 to 2 days, have shown to change a child's outcome and their chance at becoming a long-term survivor. These timelines are not in place to make things difficult for administrators. They are there because they have proven medically to make a difference once a child is diagnosed with a brain tumor. Approximately half of the pediatric population we connect with have either primary Medicaid or secondary Medicaid insurance. This legal limitation is a true concern and a reality for many families in the US. We could share a number of stories with you about families that have touched our lives. Today, we will just share 2 stories of families who are currently being negatively impacted by this legal limitation. I have been supporting a mother of a teenage girl that has been battling a brain tumor since she was a toddler. At this time, she was treated for a low-grade tumor in her home country. 2 years ago, after many years of surveillance, her tumor began to grow and change rapidly. Potentially due to her previous treatments, she has now developed a high-grade, life-threatening brain tumor. At this time, her family immigrated to the United States to ensure that she had the best care possible. Once they moved to the US, they were quickly able to enroll in Medicaid and start receiving care in a state they now live in. Unfortunately, she has continued to have progressive disease, and due to having Medicaid, they have been unsuccessful in having her reviewed at centers of excellence outside of her home state. Centers that offer different treatment options and possibly what they hope for the most, which is just more time with their daughter. This is a family who immigrated to the US to get better care for their daughter and have learned that they have more options before getting state Medicaid than they do now once they have a state Medicaid limiting her treatment centers and options. Molly will now share another story with you.
I have been supporting the family of a lovely young girl who was diagnosed with a high-grade glioma with a very limited life expectancy. The family resides in a state with only one major children's hospital. The parents have advocated tirelessly for her to receive access to care outside of her state, including any potential clinical trial options. While I've connected the family with a few brain tumor centers of excellence that offer free virtual tumor board reviews, due to the restrictions of Medicaid, they cannot receive any further treatment or guidance there. It is heartbreaking to have this conversation with the father about this. The family just simply wishes for more time with their daughter, but the options are becoming increasingly limited in their home state. Again, these are just 2 of the many stories we could share. Avoiding delays due to unnecessary administrative paperwork to a timeline that is already tight could prevent medical teams from having conversations with families focused on what life-saving opportunities could be available if legal limitations didn't exist. Instead, they could focus on supporting the families, providing education on all options available, and focusing on what treatment plan is best for their child and family. We want to thank Senator Grassley, the Pediatric Brain Tumor Foundation, National Brain Tumor Society, and Leukemia Lymphoma Society for putting together this important event today. We are honored to be standing alongside the patients, parents, and loved ones of pediatric brain tumor patients to bring their voice to such a critical cause and no longer allow these legal limitations to dictate medical decisions. If you or anyone you know could use the support of a personalized patient navigator, please do not hesitate to reach out to us at the Brain Tumor Network. Our contact information will be available, and it's a short form to fill out online, or you can call us Monday through Friday, 8 a.m. to 5 p.m. Eastern Time, and a person will answer your call to gather some more information on how we can best support you and your family in this journey. Thank you.
Thank you, Molly and Beth, for giving us some insight into how care team members experience these delays. For a patient perspective, I'd like to invite Charlotte Nathanson on to speak about her experience. Charlotte is a leukemia survivor, an LLS advocate who will be starting the 8th grade this year. She's an avid skateboarder, an active member of the Speech and Debate Club, and lives in Plantation, Florida with her parents, brother Hank, and her loving dog, Waffles. Thank you for joining us, Charlotte.
Thank you so much for having me. I'm Charlotte, and this is my mom, Natalie. And we have been advocating with the Leukemia and Lymphoma Society since I was 8 years old, so for the past 5 years. But this all started when I was diagnosed with acute myeloid leukemia. I got sick and we thought it was just a simple cold. And then we progressed to maybe a UTI or some kind of infection. And time again, the doctors diagnosed it, prescribed an antibiotic, and then the antibiotic failed again. We finally asked the doctors to prescribe a blood test. I remember this night very clearly and wish I could forget. But my mom had just put me in bed when I heard her scream. Over the phone, the doctors called her and had said, "Your daughter has leukemia. Go to Joe DiMaggio Children's Hospital," which is our local hospital, right away and receive treatment. I started chemotherapy the next day. We had no idea that over the next 5 months, what I would endure would change our lives forever. I received nearly 100 doses of chemotherapy and had 4 cycles of chemo, during which I spent my birthday, Christmas, Thanksgiving, and Halloween all in the hospital. But I was in remission, and we were so immensely grateful that the treatments were successful. I went back to 2nd grade and continued to live like a happy, normal 8-year-old for the rest of that year. Around a year and a half later, we went to a normal oncology checkup when our worst fear was confirmed. The counts looked off. After months of testing, finally, that fear was ratified, and my cancer came back. We knew immediately that we must take action because this type of cancer was the same. It was acute myeloid leukemia, which is an extremely rare and aggressive form of leukemia. We immediately looked into the best treatment options. Due to the fact that I had already received anthracyclines, and it was the middle of COVID, we decided to move to St. Jude Children's Research Hospital in Memphis, Tennessee, to participate in a clinical trial. There, I received a new drug so that I could receive my care on an outpatient basis and spend that time with my family, and was able to do online school. However, we had to move again, this time to Cincinnati Children's Hospital. There, I received a bone marrow transplant from my older brother, Hank. He saved my life, and I will be forever grateful to him. But the road was not easy. When I received my bone marrow transplant, my blood pressure dropped. I started vomiting. My head started to pound. A fever spiked, and my oxygen saturation levels plummeted. However, this is standard for a bone marrow transplant recipient. My road to recovery was long and not easy. However, I am so lucky to be here today and healthy. But I have scars, both inside and out. And that is why we're here today, to change that for the kids who come after us. Without being able to access the care that I needed, without being able to travel to other states for treatment programs, I might not have been able to get the care I needed. This is unacceptable. With a disease like acute leukemia, acute myeloid leukemia, with such an aggressive disease, we don't have time to wait for paperwork. So that is why we are here today, because we must change this so that we can make an impact on all of those who come after us. Thank you.
Charlotte, thank you so much for sharing your story. And I hope that by sharing your story, others can be inspired to stand up for patients like you. Next, I'd like to bring in Nick Pottebaum from Senator Grassley's office. Nick is the health policy advisor for Senator Grassley and works closely with patient advocacy organizations and their volunteers. Nick, we would welcome your insight into the current status of the bill.
Great. Thanks, Mike, and thanks for everyone that's been able to join. And Charlotte, thanks for sharing your story. We really appreciate it as well. I know Senator Grassley will be joining later on in the program, so I won't steal some of his comments, but I just want to talk a little bit about kind of where the bill is at that we're convening here today, and just kind of give you a sense of the legislative process that's taking place. First of all, the bill that we're talking about, the Accelerating Kids Access to Care Act, has been introduced several times in the 116th, 117th, and now in the what they call the 118th Congress, which we're in the second year of. But we've made a lot of progress, and because of the hard work of advocacy, like folks on the Zoom today, the organizations involved, we are in really strong position to try to shepherd this into law, hopefully by the end of the calendar year. So just like any bill that needs to pass Congress, if you remember your high school or middle school or even elementary civics, a bill has been introduced both in the United States House as well as the United States Senate. I work for Senator Grassley, so I'm mostly focused on the process here in the United States Senate, but there's a lot of staff, both in a bipartisan manner, both on the Republican and Democratic side, working hard in the U.S. House of Representatives to pass this bill as well. But a bill has been introduced in both chambers. And the process to pass the bill sort of looks different in both chambers, but that doesn't mean there isn't a bunch of work happening in the other one. In the Senate, the bill was referred to the Finance Committee, which deals with things related to the Medicaid and Medicare program, as well as other non-healthcare matters. And in the House is referred to the Energy and Commerce Committee, which has primary jurisdiction over Medicaid issues. And so what we've been doing since Senator Grassley introduced the bill last summer was building up our co-sponsorship. Basically, senators denoting their support, whether they're Democrat or Republican, for the bill, and then garnering the support from the committee leadership. I mentioned that the bill here in the Senate goes through the Finance Committee, and so we've been engaged with the chairman of the committee, Ron Wyden of Oregon, and his staff, as well as the ranking member, Senator Crapo from Idaho, and his staff as well. In addition, there's a lot of things behind the scenes that need to happen, usually at the staff level, educating individuals about the problem, about the solution that the bill is going to provide, and considerations that we've had. We've also been in touch with the federal agency and the executive branch, the Centers for Medicare and Medicaid Services, or sometimes known as CMS, that oversees all the state Medicaid programs and works with states and their Medicaid programs. We've been in touch with the agency to get their feedback on the bill. Sometimes we refer to that as technical assistance. And then the last major thing that we've been doing is getting, anytime a bill needs to pass Congress, it has to get what they call a Congressional Budget Office score, or a cost estimate, sometimes referred to, essentially what it's going to add to the federal budget. And so we've been working with CBO on that, and we've had some good progress in the past month on the developments of getting a CBO score. And so really, since the bill's been introduced here in the 118th Congress, we've been working hard to build support for the bill, engage with leadership in the legislative process on the bill, and really understand its cost. And so the current update of where sort of the bill stands in both chambers is this. In the 118th Congress, the House has both marked up the bill and passed it out of the subcommittee and committee of the Energy and Commerce Committee with bipartisan support. And here in the Senate, the Finance Committee does things a little differently. We don't typically have what they refer to as markups, essentially a committee meeting to discuss the bill and edit it if necessary. But that doesn't mean there isn't work happening behind the scenes. Last Congress, in the 117th Congress, Senator Grassley and his colleagues in a bipartisan manner engaged in the Finance Committee on what they called a mental health process. And a bill was drafted to focus on mental health provisions. But this bill that we're talking about today was actually part of that draft. And so we've been doing a lot of hard work with committee staff as well as the chairman and ranking member of the committee to really understand the bill and make sure it's a priority of theirs. And luckily, we got it into the mental health draft of that previous Congress. Unfortunately, that didn't pass, but the work that was built because of that actually created a really strong foundation here in the 118th Congress. And so, so far in this Congress here in the Senate, we've been fortunate to have actually a testimony on the legislation last fall, and that got the attention of more committee members in the Finance Committee and really build support for a lot of staff level conversations about making sure we understand the cost of the bill and getting a score from CBO and really making sure we have all the technical assistance needed from the agency. And so because of all that hard work here in the Finance Committee, which doesn't necessarily see sort of the public attention, we've really been in a strong position of building support here in the Senate, as well as getting committee engagement. And so what it looks like now in terms of process, a lot of bills related to the Medicaid program tend to pass in a sort of collective package, sometimes referred to as an omnibus or a health extender package. And so we continue to engage with committee leadership on prioritizing this bill because it has a CBO score, because it has such strong support here in the Senate, and because it has all the feedback from the federal agency to make sure it's included in that package. And that's what we'll continue to do to try to advance it here in the Senate. And I know a similar process is happening in the House with the bill out of committee. And so as we engage in the final legislative months of this calendar year, it's a top priority of Senator Grassley, as well as many other Republicans and Democrats here in the Senate, to get it passed as part of that package or some other form, even if that's still a little to be determined at this moment. So that gives you kind of an update on the legislative process. Certainly, I may have said some stuff that sparked some questions or some follow-ups, so I look forward to the Q&A where I can best help answer maybe some of those questions. Thank you, Mike.
Thank you, Nick. We appreciate your partnership in all of this. Before we get to our Q&A portion, I'd like to invite my colleague, Matt Marks from the Leukemia and Lymphoma Society to give our audience some background on the childhood cancer community's advocacy efforts up to this point. Matt?
Thanks, Mike. Thanks, everybody, for being here. Really excited to talk about what an unbelievably important piece of legislation this is. So, the childhood cancer community has been instrumental in moving this legislation to the point that it is now. A support letter was circulated, I believe, last year that had a group of patient organizations, both cancer and other diseases, provider organizations, researcher organizations, freestanding children's hospitals, among many other groups. That letter had over 215 and counting organizations supporting this important piece of legislation. And it is because of folks like you, folks around this table, of course, and also folks tuning in, that we are in this position we are today. Between reaching out to your local members of Congress, ensuring that they support this legislation, to meeting with them in person, virtually, attending events, op-eds in the local newspaper, sharing your story. That is the reason we are where we are. This effort has gone on much longer than just these past 2 years, but we are in this position because of the work that the foundation that was laid over the past few years, but really capitalizing on this momentum because of the groundswell of support and from, frankly, the examples and stories that we hear of how these delays impact the care and, frankly, the lives and the mental health of the children and families who are already undergoing such a terrible disease, but are able to, really focus on what's important, which is ensuring their child can, be healthy. And we can't do that when parents are forced to sit and wait for paperwork to go through, and for administrative burdens to be the thing that prevents your child or a loved one from accessing the care outside of your home state that you may need. And so I think it would be silly if I stood up here and didn't say thank you to every one of you who are tuning in, because you're doing such phenomenal work and continuing to do so. And so, Mike, I will pass it back to you, and I look forward to any questions you may have.
Thank you, Matt. I'd now like to turn it over to our friend Natalie Schmidt from the National Brain Tumor Society. Natalie will be moderating our Q&A. A reminder to use our Q&A function to submit questions. And if Senator Grassley breaks in, we will pause for his remarks.
Thank you, Mike, and thank you everyone for being here. From everyone at NBTS, we also just want to thank PBTF, LLS, and Senator Grassley and his staff for this legislation. We know that it will help childhood brain cancer patients, among other cancer patients, better access care. So we're really grateful to be here. I will start with a few questions that were already asked, but like Mike said, please feel free to leave additional questions in the chat, and we will be monitoring that. So our first question,
our panelists, I'm sorry, Natalie, our panelists can come on video for the Q&A portion.
Yeah, and feel free to jump in where this might apply to you. Kind of piggybacking off what you said, Matt, one of the questions is, how can advocates help support this bill over the next few months?
I'm happy to answer that one, and I think my friend Nick would as well. And that is to ensure that your elected officials, your member of Congress, your 2 senators are supporting this legislation. And if they are, ensure that you say thank you, because, staff like Nick and members of Congress and everybody works so hard to, read through and vet and co-sponsor pieces of legislation that are important, and they don't often get a thank you. And so, ensuring that your elected officials are supportive of the legislation will make a difference for when it comes time to figure out what is passing and what is not.
And I'll just add on to what Matt mentioned. We've built a lot of support here in the Senate for the bill. Currently, there are 41 co-sponsors or sponsors. That's 41% of the United States Senate. So we're nearing the halfway mark. So that's pretty remarkable. And that work wouldn't have happened because of just Senator Grassley. I know individuals like Charlotte and many other people across the country are contacting their senators and representatives and asking them to support the bill. And even if your senator representative in your state isn't supporting the bill, but you continue to have conversations with them and their staff, that's really important as well. Making sure they're educated and aware of the bill goes a long way sometimes. And I know because of the issue that we're talking about, you might have specialists, doctors, and other healthcare professionals who work in another state. And you can have them advocate directly to their senator and member of Congress. But 41 is a lot of senators to support a single bill. The last time I checked, there are only 2 bills before the Finance Committee that are healthcare related that have more support than 41 co-sponsors, and there are thousands of bills introduced in the United States Senate every Congress. So we've made a lot of progress. That certainly means we shouldn't slow down, as Matt mentioned. We got to continue to, but we've made some really good progress. And the primary thing you can do is reach out, whether it's through phone, email, meetings, to engage in a conversation. If you get your member of Congress across the finish line to support it as a co-sponsor, that's even better. But having those conversations and educating staff and members is really important as well.
Thank you, Nick and Matt. It's really helpful. Our next question is, what resources are available to families in crisis?
I can jump in, and maybe other individuals can chime in as well from associations and folks. I know every state has a family-to-family health information center. This is actually something Senator Grassley will briefly talk about, but the Family Opportunity Act, which passed in 2003 in a bipartisan manner, created what they call F2Fs, or family-to-family health information centers. They're supposed to be essentially a free resource to provide families to navigate the healthcare system in their state. And they can reach out, and you can usually Google, or most of the time there's an easier way to find your family-to-family health information in your state. For example, most states don't call it an F2F or a family-to-family health information center. It's usually got a different branded name. In the state of Iowa, we call it Ask Resource, but your state's F2F, or Family-to-Family Health Information Center, would be a great first start to figure out what resources and information is available for you to navigate your specific situation in crisis, as well as long-term, and finding the medical resources as well as the wraparound resources that you probably need as you go through the diagnosis and treatment.
I should also point out that all of us, our family support teams, do an incredible job. And at the very end of this webinar, we will have some information for all of our family support teams so that you can reach out if you need resources or if you need help.
The next question is likely for you. Again, Nick, will this bill pass the House of Representatives, and if so, when?
That's a great question. I wish I had a specific answer for you, because my answer probably would have been different last year or the previous year in a different Congress. The House of Representatives is a different body than the Senate. And so, as I mentioned in sort of my opening remarks, it's a different process and they're a different stage. The bill has gotten out of committee in the House of Representatives, and that's a huge progress. Sometimes the House of Representatives will pass the bill on the floor, meaning they'll pass it out of the chamber and send it over to the Senate. Congress has basically between now and December 31st to pass this bill. Otherwise, we unfortunately have to start the process over, and Senator Grassley would have to reintroduce the bill and go through the process. That doesn't mean that the work that's been done this Congress would be lost. It just means we have to sort of restart some procedural elements. Our goal is to get it passed this year. Like I mentioned, we've gotten a Congressional Budget Office score that shows the bill only cost about $218 million over 10 years. Which might mean like a big number, but in the scheme of the Medicaid program that costs hundreds of billions of dollars, that's actually quite small. And that's very encouraging because the Congressional Budget Office originally thought it would cost well over $5 billion. And so we brought in the score down significantly. And the reason why I bring up the score is that typically is one of the biggest hurdles to stopping a bill from becoming law. And so because we have clarity from the Congressional Budget Office about this score, that gives us a lot of momentum to build support and engage in the process to pass a healthcare bill. I know it may seem a bit foreign, but here in the Senate, we have to unfortunately sort of work in a kind of behind the scenes staff level process to try to prioritize legislation that Senator Grassley has, that other senators have on both sides of the aisle with the Finance Committee and their leadership. And so that's why Chairman Wyden and Ranking Member Crapo, both of Oregon and Idaho respectively, are so important, because getting their support means we can try to get this bill attached to a larger piece of legislation to Medicaid and Medicare provisions that typically pass at the end of the year, because there's stuff that will, as we in Congress say, will expire. And so that might be a lot of lingo, but the bottom line is we're really trying hard, and we've checked a lot of really important boxes to get this bill across the finish line this year. But that's part of the reason why we're having discussions like this today, is to mobilize you all to re-engage and continue to engage with your members of Congress and educate and tell them why this is a priority. Because the more we communicate this is a priority in a respectful way, the more likely we can get this attached to some kind of health package to ultimately get it across the finish line. And so I know it can be, I sometimes refer to this process as a bit of a black box because you don't know exactly what's going on. But it's really important to continue engage even when it doesn't feel like there's progress being made, because that progress really, or that efforts really, really do matter. So that's probably a longer-winded answer than I probably should have given, but bottom line is we're optimistic, but we don't want to hold anything back to try to get this accomplished this year.
I think that's a really good point. And to quickly add on to what Nick said, I think what folks tuning in can do to ensure that it does pass the House and, of course, hopefully the Senate as well, is to reach out to your members of Congress. And if they are, if your member in the House has not co-sponsored, asking them to co-sponsor the bill and to also vote yes when it comes on the floor. And then if they have co-sponsored the bill, make sure to thank them and then urge them to ensure that they do vote yes when it comes on the floor. Making sure that we are ready for when that moment does come so that when the question is asked, the bill can pass overwhelmingly, which I think would give folks who make those decisions a lot more comfort in prioritizing a bill like this versus another bill that might get consideration on a specific day.
Thank you, Nick and Matt. That was really helpful context. And there are several questions regarding the CBO score. So I think you answered 2 questions in one. But if there are additional questions on the CBO score, please ask them. Some people are wondering if and how the election might delay the passage of AKACA or if it will have no effect.
I certainly will let others chime in. I work in the Senate, and so I'm not engaged in any election activity, and not engaged in any political campaign. The Senate does have a calendar, and we currently are expected to be in session next week, and then we'll be in September. And so obviously the election changes when Congress is here, but Congress will be doing plenty of work behind the scenes between now and December 31st, and we'll be in session for a lot of things, including passing appropriations bills, et cetera, in September, November, and December. And so I'm not going to necessarily engage on the outcome of election or how that might impact, but it certainly changes the schedule legislatively. But that doesn't mean things aren't happening to try to get the bill accomplished and passed ultimately. So yeah.
Yeah, I think that's an important point. Even though politicians are focused on their campaign, it doesn't mean that folks like Nick aren't back and be working with one another to try to get this passed. So from what we've heard, and maybe Natalie and Matt, you can chime in too. This bill is still being worked on. There's still a lot of focus on it, and I think it's important that we continue to kind of beat the drum that this is important. It should be prioritized.
Absolutely. Thank you. This question is for Charlotte and Natalie. What advice would you give children or parents who want to get involved in advocacy?
So I think Charlotte has dropped off. Hopefully when she comes back on, we can ask that question. I know Charlie is on. If you want to take a stab at that question and tell the folks about the most rewarding part of being an advocate for you.
Yeah, I think when you get started, all this can just seem so big, I guess. Like there's so many people, but it's really not. So I think if you try really hard, you can make way more of a difference than you think.
Absolutely. I also think too, it's helpful to remember that the folks that you're talking to in Congress and their staff, they're all just people like us. And so you're sharing your story, I think, is one of the most powerful things you can do. But like Charlie said, there's a lot of really good change you can make once you just jump right in. Awesome. This next question is for Beth or Molly. How do delays affect the care plan of a patient that a care team is receiving?
I can start, Molly. Feel free to add anything in. I think it is very dependent on diagnosis. It's very dependent on what is offered. But standard of care treatment plans, so everything that has been proven, research-based, it is what should ideally be offered anywhere that a child is diagnosed. And I can speak specifically, I guess, for brain tumors, but I know this applies to many other types of tumors as well. They have a very specific timeline. It is a protocol that has been studied, that has been researched, and there are very specific time points that are important for things to happen at. Excuse me, and delays that are unnecessary or not medically necessary really impact the outcome. So taking an extra month or weeks, even days sometimes, to get the care that you need anywhere really impacts the outcome survival rates and the success that we see in a lot of the treatments.
And kind of piggybacking off of that, even at initial diagnosis, if things aren't started in that time frame, that can then have a snowball effect for later for potential clinical trial options. You might have had to initiated standard of care within a certain period of time, or received your treatments over X amount of time. So any delay can, at that point, receiving the drug, obviously it's a delay, but it could also impact future treatment options as well.
Thank you. Our next question is if there are one-pagers or leave-behind documents that we can use when we go to talk to our members.
At least I know both, I'm sure the associations have some material, but Senator Grassley on his website has a press release as well as a summary of the legislation that we can disseminate, I think probably maybe after. I'm happy to throw it in the chat box if that's easier. Just give me a head nod, Natalie or Mike. But we can certainly get you that information. So you've got sort of the key points of the legislation and what it's doing in terms of scope of the problem and how it's solving it.
Yeah, if folks want to reach out to either me or Matt or Natalie, I know that all of us have access to one-pagers that we all use for this specific legislation.
Awesome. And I wanted to jump back to the question that Charlie also was able to provide some great context to, but Charlotte and Natalie, we are wondering what advice would you give children or parents who want to get involved in advocacy?
Well, advocating has been just such an impactful experience. You know, when we first walked into the congressional building, it was just so amazing to exercise our rights as Americans and to be able to feel that our voices were really heard and that what our experiences mattered. And we were able to make a difference in the lives of others, to continue to put out positive change into the world and help other people.
And to add to that, I would say, you know, that as the mother of a child who had cancer, I ask myself every day, why? Why did that happen? Why did that happen to her in particular? Why did that happen to our family? And to watch as Charlotte has turned something that was a negative into a way to make change in the world and to give her life purpose and to try to better the cancer survivorship community has been very empowering. And, you know, just watching her develop, and it's been very meaningful. So we're very grateful to the Leukemia and Lymphoma Society for the opportunities that they've given us and for being able to participate in today's event. So thank you all for listening to our story, and we're here to support the AKACA in whatever way we can.
Thank you. Our next question is, does this bill only apply to children with cancer?
The answer is no. There's a specific definition of what they call kids or children with complex medical needs. That's in federal statute. And that has kind of a two parts to the definition. We don't necessarily need to go in the technical legalese of it. We can send you that afterwards. But essentially, an individual who's in a Medicaid program, who's defined as a child with multiple chronic conditions, which can include cancer and other diagnoses, as well as a rare disease, would fit in the definition of children with complex medical needs. Hopefully that answers the question, at least at a high level. So the simple answer is no, you don't have to have cancer. There's a lot of kids who would benefit from this bill because they have cystic fibrosis, they have a rare disease, et cetera, that meet the definition of children with complex medical needs.
Thank you. This next question, I think, might be best for Molly or Beth, but the question is, what about brain tumors without a standard protocol? It is so hard on families when doctors around the country are all doing something different because they don't agree on how to treat.
Yeah, it thing. And I think realistically, the best thing is to get those second opinions as you can. Meet with this team that you feel is meeting your family's needs, your child's needs. And sometimes that is in another state, which is prohibited when you have Medicaid in a lot of these situations. But finding another physician that can give an opinion and can look at the records of your child and give insight on their options and how their options meet your family's needs and priorities. There are many diagnoses that we're still being researched all the time. And so that is a very difficult thing. We're always happy to help identify centers of excellence for you as well, if we can.
Thank you. So our next question is asking, how many children do we estimate that this bill will help? What estimates of delay exist for families? And is there some research that says what the typical delay that families experience? You know, Matt or Nick, if you have any insight on that.
Yeah, maybe I'll start, Matt. We don't have a specific number. I think broadly there are hundreds of thousands of kids that would meet this definition. Obviously, they have to be identified and enroll in the Medicaid program if they're eligible based on their state's criteria. So that plays a pretty big role. And every state's Medicaid program, unfortunately, looks a little different. In terms of evidence, every case is different. I know everyone on this Zoom, nearly 100 people, probably have an individual story about delays in care. We know anecdotally that a lot of times even care that gets authorized by an insurance company or provider can take weeks, sometimes months to get. And so I don't have a specific number, but we know that, say, Medicaid programs track some of this data and have a good sense of that delay in care. But every situation is going to be significantly different depending on if it's a life-saving surgery or is a series of treatments that are needed. It's also unfortunately going to be based on which state you're in and which state you're trying to go to get that care. There is a lot of data out there, but it's somewhat disparate, and so I don't want to hesitate before to start sharing a bunch of information like that, but happy to do some follow-up. And I'm sure Matt can make a better answer to that question.
No, I think that's exactly right, Nick. And I think one of the issues that we have here is that we don't get a lot of clarity around the delays because of one, how many there are, and two, how long they can take. I mean, there are examples of patients who are still waiting for approval after months and months and months, simply because the children's hospital that they were going to couldn't get somebody on the phone from the home state Medicaid program, right? And there are also examples of providers who, in order to have a child go 45 minutes to their state across a state border, have to send a physical copy of their social security card via snail mails, right? So it's hard to quantify, but what I will tell you is that roughly half of the children in the United States are enrolled in Medicaid. I think the most recent enrollment said that there's about 37.5 million kids on Medicaid. And so, another reason that it could be hard to quantify is, there's a lot of kids who are enrolled, but then you have children who are not on Medicaid right now, but due to the diagnosis of their disease, cancer or not, will then newly be eligible for Medicaid due to a different policy, right? And so, we know that there will be tons of children and families who will be benefited by this bill, but then there are also going to be countless number of kids who are not enrolled in Medicaid now, who by the time they do need Medicaid, it will be at a moment where they need to go across state lines for care. And so the bill is extremely necessarily important, and that's why we make the case that hearing stories of patients that have had difficulties going across state lines, and then also hearing from the hospital administrators and staff and providers of the frustrations that they have had having children trying to go across state lines to get into their care, are really the thing we're focusing on, because it's extremely hard to quantify, but we know it's out there because we continuously hear about it from patient providers and other organizations.
Thank you, Matt. That's super helpful. Might have time for one or two more questions here before Senator Grassley joins. This next question is, do we know the senators who are on the fence of supporting the bill and who are most likely to be influenced in a short period of time, so advocates can focus on them and their state?
Actually, before we do that, it looks like we have Senator Grassley here. As most of you know, Senator Grassley is the lead sponsor and author for the Accelerating Kids Access to Care Act. So thank you for joining us, Senator, and the floor is yours.
Thank you. I'm glad to be with you. You can tell me when you want me to start.
You're free to start, Senator.
Thank you very much. I want to say good afternoon to all of you that are on this Zoom. Thank you for inviting me to speak about the Accelerating Kids Access to Care virtual town meeting. Your stories of facing pediatric cancer or rare disease inspires a lot of people in the member of Congress. And we listen to a lot of these with people with the various disease causes coming to our office, sometimes regularly for over several year period of time. So it's not surprising that you're having this meeting, and this is the most efficient way to do it. But if you ever come to Washington and want to meet with me, I'd be glad to have that. I've worked hard to improve access to high quality care. Each one of my efforts has been bipartisan, as you would expect it to be in the United States Senate, because nothing gets done here if you don't have 60 votes to stop debate. And when you have a 51-49 makeup of the United States Senate, you can see that that's not an easy job to do, but the institution of the Senate forces that sort of cooperation, and I'm glad that it does. So I said each one of my efforts have been bipartisan, and a long time ago, maybe 20 some years ago, I worked with then Senator Ted Kennedy to pass what's called the Family Opportunity Act. More recently, I've worked with Senator Bennett of Colorado to pass a bill that we entitled Advancing Care for Exceptional Kids, and we call that the ACE Kids Act. ACE Kids better align Medicaid rules and payments to incentivize coordination of care. I don't need to tell you, I suppose this affects everybody that's on this Zoom. Many of the kids and their families joining me today see 5 or 6 doctors, 20 to 30 maybe health professionals on a routine basis. There's a lot of care coordination that doesn't happen. Particularly if it's left to the parents, finding it hard to, I'll use Washington language by saying dealing with the red tape. The ACE Kids law is fixing that. Well, we've made a lot of progress with 2 laws that I mentioned. There's more to be done, and that's why I've partnered again with Senator Bennett to introduce a bill that goes by the title of Accelerating Kids Access to Care Act. It provides states the ability to streamline the screening and enrolling process for out-of-state pediatric care providers so that life-saving care that your kids need isn't delayed because of red tape. The bill removes regulatory burdens that slow down kids from receiving the life-saving care that they need out of state. We streamline care without compromising on program integrity standards. This legislation is something I'm proud of. It was included in the Finance Committee's mental health draft in the 117th Congress, and in the 118th Congress, we were able to have Charlie, a 12-year-old brain tumor survivor, testify on the bill before the committee. For the past several years, I've also been working to get a cost estimate for the bill from the Congressional Budget Office. And as of last month, I'm pleased to have received that estimate. And I know $218 million sounds like a lot of money. That's a figure, that's spread out over 10 years. And it's far different than the billions of dollars that CBO initially thought that our legislation would cost, which maybe would make it prohibitive to get the votes in the United States Senate to get it passed. I'm also glad to have strong bipartisan support for the bill. To date, 41% of the Senate is co-sponsoring the bill, and it's one of the most co-sponsored bipartisan healthcare bills before the Finance Committee. The House has also made progress in reporting the bill out of the committee that they call the Energy and Commerce Committee, thanks to the bipartisan leadership of Representative Trahan of Massachusetts and Representative Miller Meeks of my state of Iowa. The momentum is on our side, but we must keep pushing. You can't help add to this, you can help add to this effort by promoting bipartisan support, asking your senators and representatives to co-sponsor the bill. In the past 40 years, Congress has taken action to support the dignity of exceptional kids. We've enabled kids to live and be cared for in the home and the community rather than in some institution, while also ensuring that they get the best hospital care possible. Congress must continue to build on these successes and on the decades of bipartisan work that I've been a part of. I thank you for your efforts today. Thank you for listening to me. And I think I would have time maybe for one question.
Thank you, Senator. Yeah, we have a special guest here to ask you a question. Many of you already know that our advocate Charlie has been outspoken in his support of the bill and had the opportunity to meet with Senator Grassley and his colleagues last year. Charlie, I believe you have a question for the senator.
Yep. Thank you, Senator Grassley. It's nice to see you again. You can actually see the picture behind us. But last year I used my Make-A-Wish to get to DC and speak to the Senate Finance Committee about the importance of the CACA bill. Why are personal patient stories important for legislators to hear?
Well, it makes things very, very personal. It's easy for members of Congress to explain constituents why you're having legislation of almost any type of legislation, if you can put a face with it. And in this particular case, we can put Charlie's face with the legislation, but also it helps move the legislation along. And I would use as an example something that happened a long time before you were born. So let's go back probably 30 years, maybe 35 years. There was a mother of a Katie Beckett that required lots of care. And the laws or rules at that time was she was going to have to be put in an institution to get the care. And Katie Beckett's mother came to those of us in Congress and said, you know, that's a stupid thing to do. With just a little bit of help, we could take care of Katie in her home. And we were able to, I think in that particular instance, we didn't have to pass legislation. I think what we had to do was work with HHS and CMS to get rules changed so that that this could be accomplished. And Katie Beckett then never had to go to an institution. Katie Beckett was able to stay at home, finish high school, go to college. Now it happens that maybe Katie died when she was maybe close to 40 or something like that. I had an opportunity to go to the funeral and follow up on that. But she had a very productive life while she was living and at home, and saving the taxpayers a lot of money and having a quality life with mom and dad. So that's just one example. And of course, you heard me talk about your involvement in the committee, and that brings your face to it, but a living example of what we need to help move things along. So I thank you all very much for participating.
Thank you very much, Senator. We really appreciate your time. I think Senator Grassley has to drop off, so we'll return back to the Q&A portion, and I'll let Natalie take over.
Thank you, Mike. This next question, likely for either Nick or Matt, but the question is, will this bill affect Medicaid approvals, or does this simply streamline the process?
That's a good question. I would say kind of by doing one, it kind of does the other, in the sense that when a child on Medicaid needs to travel across state lines, there's a multi-step process that needs to go through before they're cleared to travel. AKCA would remove one of those steps. That is, providers need to be screened and enrolled in another state Medicaid program. And so by removing that paperwork burden, a child can be that much closer to being able to travel for time-sensitive care. So it impacts the approval process, but again, there's a few steps in that process.
Yeah, and it's important to point out it doesn't require care for patients that are traveling over state lines.
Right, thank you guys. Next question, likely for Nick. If this bill doesn't pass this session, would it be reintroduced?
We certainly don't want to think about that scenario because we'd love to get it past this Congress, but Senator Grassley has been committed on this priority, as he just mentioned, talking about the Katie Beckett waivers from the 1980s, but also his legislation with Senator Kennedy in early 2000s. He'll continue to shepherd this effort in the bill, as well as, I think there are probably countless issues that we're not even solving in this bill that need to get addressed as well. So he'll continue to be committed to the issue at large as long as he's here in the United States Senate. It's a passion of his, as you just saw. But I imagine if we're in the scenario where we need to reintroduce it, we'll go down that path. But we're going to keep focused on building the support that we have today. And really appreciate the question.
Thank you. Our next question is, do we know the senators who are on the fence of supporting the AKACA and likely to be influenced in a short period of time so advocates can focus on them?
Well, I would say it's, you do 100 minus 41 and you get a specific number of 59 senators. If I do my math correctly, someone can check if I'm wrong, but I'm pretty sure it's 59. Obviously, there's a committee here in the Senate, the Finance Committee, that plays a really significant role in moving this legislation along. And so one area where I would check is if a senator is on that committee and not co-sponsoring the bill. And we would be happy to provide whoever asked this question kind of an offline an assessment of that to make it a little easier. I think that's a great place to start because those are senators who play an outside influence over the Medicaid policies passed in the Senate because they're on the Finance Committee. But it also means they've probably been engaged in some manner on this issue, whether they've had conversations with myself, advocates have contacted them, or they heard from Charlie when he testified before the Finance Committee last fall. And so that's a great area to start. You could do the exact same thing in the House of Representatives, but since the bill has gotten out of committee, really the focus should be the House Representatives at large to the members that haven't co-sponsored the bill, which I think, we've got a lot of co-sponsors in the House, but I think it's still close to 2/3 who haven't. So there's plenty of opportunity of adding people to that list.
Great, thank you. Mike, I think this question is for you. How can advocates submit patient family stories regarding the Accelerating Kids Access to Care Act?
Yeah, at the end of this, we will share an email address that you can send your stories if you've been affected by a delay. Yeah, we would love to hear from you and be able to share that with legislators. The email address is patientadvocacy@curethekids.org, and I can put that into the chat.
Thank you. I think that is all of the questions I am seeing right now. If folks have other additional questions, please feel free to keep putting them in the chat. I'm happy to answer any other last minute questions.
And I just want to maybe add one thing just to show how your all advocacy has played a huge role. I learned a few minutes ago that Senator Collins of Maine has decided to co-sponsor the piece of legislation. And I know we've been talking to her staff as well as I know advocates from Maine have been talking to her directly for some time and has previously supported the issues that Senator Grassley mentioned. And so that just shows the progress of having these town halls, having your advocacy, reaching out to your members and continuing to have those conversations, even if you don't get a direct yes right away, just proves how important it is. You can certainly do it in a respectful way, but continued engagement really pays off. And so I don't know if we have anyone from Maine, but just a huge congratulations and thanks for their support. That adds to 42 senators now. Senator Grassley said 41, so we've made progress even in the time that we've been together today. So kudos to the work that you're doing.
Natalie, I had one question, and it's actually for Natalie and Charlotte. Natalie, I know that there are a lot of caregivers and parents on this call. What advice would you give them in terms of helping support their children if they want to tell their story, or if they decide they want to go and meet with legislators or advocate on behalf of an issue? And then Charlotte, is there a favorite time that you've advocated, or is there a specific example that stuck out to you in your advocacy journey?
So thanks. That's a great question. We were lucky to become connected with the Leukemia and Lymphoma Society. I think that it's possible that which organization you might get involved with might depend on the type of disease that your child has. Certainly, Leukemia and Lymphoma Society is always looking for volunteers, and I would imagine the other organizations on this call are as well. If your child had some sort of a different disease, then a resource you could check would be to start with your hospital or with your doctor, because they are probably connected with various advocacy groups. I know of another one called something about advocating for childhood cancer. I always wonder why it's not called advocating against childhood cancer, but there's one out there called Advocating for Childhood Cancer that brings a group to Washington every year. So, thank you, Matt. The Alliance for Childhood Cancer is what it's called. So they are a wonderful group to get involved in if your child has some sort of cancer. But starting with these patient support groups, and if you don't know of one in particular, I would ask your hospital, maybe Child Life or the social worker who's assigned to your child would be able to give you some information.
And you asked about a specific instance that was, really impactful through advocacy, but there is no one instance. Being as the first time we did it via a Zoom meeting, or the third time we did it when we finally got to walk the halls, it has all been such an amazing journey. And what's really amazing is to hear about how these bills have continued to make progress. We were up just last May on Capitol Hill, and then we've heard that the bills we've been advocating for passed in subcommittee, passed in the committee, and the AKCA is making progress, and other bills that LLS has been advocating for have been making progress. And that is what's so amazingly gratifying, not just for myself, but for all of those cancer survivors out there and those yet to come who need these laws to be passed. So I can't pinpoint it on one specific instance, but it is all of the work that we have been doing for the past so many years.
Yeah, Natalie mentioned the Alliance for Childhood Cancers Action Days. I don't know, Matt, if you want to plug that and give folks an update on when they can expect some more information.
Yeah, thanks, Mike. Happy to. So the Alliance for Childhood Cancer is a coalition of childhood cancer organizations that all come together. We're in coalition, so we're always talking, we're always communicating, sharing information, but once a year, usually in the first quarter of the year, so sometime between February, March, April-ish, we will invite folks to come up to DC to advocate for policies to benefit childhood cancer patients and survivors. And so there you will find information from the organization, most likely that invited you here today. But then the Alliance itself also opens up registration usually towards the end of this year, early next year. And so we are looking forward to having folks once again come up to DC to advocate for important policies. And I will say that, you know, while some folks do come on behalf of an organization, you need to come through an organization. You can certainly register and come out to DC, and you know, we block a number of rooms off in a hotel, and there's a day of programming, and you'll be well equipped to come to Capitol Hill.
Thank you. I think we have time for one more question. And this one is from Jen. Does the bill need to pass in both the House and the Senate during the same year? I think that might be a question for you.
It's a good question. The bill needs to pass in both chambers to become law, and obviously it would need to be signed by the president during the same Congress. And so what that means is Congress convenes. We're currently in what we call the 118th Congress, and so that goes from 2023, the beginning of 2023, to the end of 2024. And so it would have to pass this year because we're in the second year of the 118th Congress. But you would technically have at the beginning of a Congress 2 years to pass legislation in both chambers to then be signed by the president.
Thank you, Nick.
Okay, thank you all for your questions. I'm sorry that if we weren't able to get to your question, but I'm going to throw it to Matt now, who will lead us out and give us a call to action.
Thanks, Mike. Really appreciate everybody who logged on and who stuck around, and then of course those who will be listening later on the recording. There's no way that this piece of legislation would have been anywhere near as successful without the help and efforts and workings of you guys. You're the ones who have reached out to your members of Congress. You're the ones who have written letters, hosted meetings, gone to events. Folks like Nick don't necessarily want to just hear from people like me or Mike or Natalie. They are much more likely to prioritize legislation and support legislation if they hear from folks like Charlotte, if they hear from folks like Charlie. And so please know that your voice is the reason that we're sitting here today talking about all the excitement that has gone around this bill, and how you know, fingers crossed, if we can get this across the president's desk before the end of the year, it won't be because of me or Mike or Natalie. It will be because of you. And so here's how you can help, especially in the immediate aftermath. Urge your senators to co-sponsor the Accelerating Kids Access to Care Act, and also tell them that we need to move the bill, so move it in to get it signed into law by the end of the year. And that involves calling, writing, and meeting with your members of Congress. August is a great time to meet with your local representative's office while they're back home for the month. And then leaning on the advocacy organization that invited you here today. And if you came here on your own accord, welcome. We'd love to have you. And you can reach out to one of the organizations that you see listed here that most applies to your circumstances and situation. And here's our contact information, of course. And also, the thing that won't get this done is, again, it won't get done by hearing from government affairs representatives like me, Mike, or Natalie. It will happen by sharing patient stories, hearing from folks like you. And so if this this issue has affected you, your family, someone you love, a friend, please reach out to patient advocacy at carethekids.org and submit those patient stories. And we look forward to working with you to ensure that your voice can move as many elected officials as possible. And again, if your question did not get answered, please feel free to reach out. And most importantly, If you, a loved one, someone you care about, someone you know, a stranger you meet on the street, needs the resources of any of our organizations, you can see that there are email addresses and websites that you can go to that has a whole slew of resources. We are all here to help you, and we exist to serve folks like you. So thank you again for coming, and we look forward to working together for the rest of the year to get this bill finished.
Thank you, Matt, and thank you all. Please be on the lookout for a recording of this event.